It starts with the food. The government subsidizes the production of some foods and crops, like corn, which warp food markets. Artificially cheap ingredients like corn syrup then crowd out healthier options that consumers actually prefer. Companies then produce addicting, highly processed foods with the enthusiastic support of the government and government-accredited food science programs that are often funded by these food conglomerates in the first place. That is great for the food industry, which enjoys government support as they get the population hooked on artificially cheap, highly addictive food. But it's terrible for our bodies. Most of the chronic health problems Americans are suffering from today can be drawn back to our consumption or our parents' consumption of this highly processed food. Instead of treating that root issue and taking money away from their friends in the food industry, the government instead uses this awful situation to also enrich their friends in the pharmaceutical industry. Through the accreditation of medical schools and licensing requirements, the government institutionally props up a specific approach to medical care that almost exclusively seeks to treat symptoms with a barrage of drugs rather than explore and address the root causes of bad health. So Americans are all but forced to take an extensive drug cocktail that enriches drug companies while allowing them to stay hooked on toxic foods that their bodies are trying to tell them are hurting them. Meanwhile, those regulations and requirements the government placed on medical services in order to exert control over the industry limits the supply of those services, creating shortages and raising prices. On top of that, for the last 50 years, the government has been rolling out programs like Medicare and Obamacare that slam the healthcare system with demand while leaving those artificial supply shortages in place. That, along with regulations that have warped the health insurance industry into a crony blanket third-party payment scheme, has resulted in the explosion of healthcare costs that we've seen over the last several decades. And that's not to mention the public health component, which helped lock down the country before pressuring huge swaths of the population to consume a pharmaceutical product to return to their normal lives. Above all, the American healthcare system can best be understood as a massive racket aimed at moving as much of our money as possible into the pockets of government bureaucrats and food, drug, insurance, and healthcare companies. RFK Jr. and his supporters understand this. Their whole professed mission has boiled down to breaking this terrible cycle that's destroying our health and economic well-being to benefit the well-connected. Instead of reassuring people that the functions of HHS will stay in place as some staff get cut, they need to better communicate why those functions are the entire problem to begin with.